weight is taking a toll on my heart, my kidneys, my liver, my legs. I feel helpless, worthless.
The blood glucose is 423.
That is way too high. The normal fasting blood glucose is less than 100.
Because of my weight, I am diabetic. And what scares me the most is that my kidneys will fail again. I've already got into a diabetic coma.
A diabetic coma occurs when somebody's blood glucose is either so exceedingly high or so exceedingly low that they lose consciousness. And this can be a very, very dangerous situation. With her, it sounds most likely like her blood glucose was way too high. As she had said, it was over 400 when she had just measured it. And in people who are morbidly obese, this can happen. Now, type 2 diabetes occurs quite commonly in people who are significantly overweight. And in her situation, it looks like that diabetes may be going out of control.
It's been 10 years since my coma and I haven't walked on my own since then. So now my bed is my restroom, my place where I take a shower, where I do everything.
This poor woman is basically bedridden due to her large size, and at least she does have her husband there to help take care of her, but what a difficult existence. When we determine as physicians the quality of a person's life, we look at how many activities of daily living they can actually carry out. In her situation, being bedridden, she can't do a lot of the normal things that a person should be able to do to take care of themselves.
Today we're leaving for Houston. I'm leaving everything I know to save my life.
I really give her credit that she is taking this jump to take care of herself and to improve her health, because the way she looks here, it doesn't look like she would have a whole lot of time left on this earth if she continues in the path that she's going. Being immobile like this can lead to not only problems with your heart, with your blood sugar, but it can also lead to issues like pressure sores. When you're lying flat for so long, you have pressure on different bony prominences, and this can cause open sores to occur. They can get infected, and people can even die from that.
Hello, is this Dr. Now? I'm calling for my wife, Lupe. She's having problems with her left leg, and I think she might have a blood clot in her leg, maybe.
A blood clot in the leg is very, very bad. When you are immobile, when you're not moving, you can get stasis of the blood in the veins of your legs. Essentially, the blood in the veins of the legs, they don't pump and they don't move blood unless your muscles are actively flexing. And so if that blood is just sitting there and it's pooling there for hour after hour after hour because you're not moving, it can actually clot. And the reason why that's dangerous is because if that clot dislodges and goes to your lungs, it can prevent the transfer of oxygen to the blood, and you can literally die.
If it is something like a blood clot in her leg, she could be moments away from a life-threatening event like pulmonary embolism.
So the term pulmonary embolism refers to a blood clot in the lungs. As I mentioned earlier, if you have a blood clot in your lungs, it can actually prevent the transfer of oxygen from your lungs to your blood supply. If you're not getting oxygen into your blood supply, you can basically die within minutes of a pulmonary embolism. And this is a common cause of death in people who've had way too much surgery, as well as people who, let's say, have been immobile and they've flown on really long flights or gone on really long car rides. Now, the way that you diagnose if she has a blood clot in her leg is a Doppler. It's like an ultrasound to see whether the veins in the legs are still open or patent. If they're clogged, then you know that that's a blood clot. The way to diagnose a pulmonary embolus is different, however. In those situations, we'll usually get a CT scan of the heart and the lungs to see whether you can see clot in those blood vessels.
We have ruled out blood clots, but her heart is in failure and it's only functioning about 35% capacity right now.
So when you are massively overweight, you have to still have the same heart pump blood to all the different parts of your body. Okay, and if you are smaller, the heart pumps blood not as far, but when you are larger, it takes so much more work for your heart to pump the blood to all those various body parts. This combined with underlying cardiac disease, pulmonary disease, all of that can predispose to heart condition like what she looks like she's dealing with. This seems to me to be a very, very dangerous situation for her, and I'm definitely really concerned.
What seems to be your biggest challenge with your eating habit?
I'm an emotional eater.
Who brings you the food?
My husband, my family.
They don't realize that they are killing you?
I know.
It's always the husband or the boyfriend that is the enabler. And I'm surprised I didn't hear Dr. Now call him an enabler, because obviously he is. For her, she's bedridden, so she can't get up and make herself her food or order her food or get the food, let's say, from DoorDash and pick it up because she's stuck in bed, so he has to get it for her. Now, when she mentioned the term emotional eater, this is a term that's now being used for people who basically, when they are dealing with difficult emotions, so they sometimes will overeat food to deal with painful emotions. I have a good friend of mine, her name is Trisha Nelson, and she is somebody who works specifically with emotional eaters to help them get through that situation so that they can eat healthy and be healthy again.
At her size, she's been consuming at least 20 to 30,000 calories a day.
Now, the average woman eats about 2,000 calories a day. The average man, 2,000 to 3,000. She's eating 20,000 or 30,000 calories a day, which is literally 10 to 15 times what the average person, the average woman eats. So if you were to look at that, how much food actually is 20,000 calories? Well, a Big Mac meal is about 1,200 calories or so. So 20,000 calories would be like eating 17 Big Mac meals. Not 17 Big Macs, but 17 Big Mac meals, meaning Big Mac, fries, and a drink. That is a ton of food, and her husband must be once again getting that for her.
We finished running tests on Lupe, and now that she's rested, we're going to get her up and get her weight to see where we are starting from. 642 pounds.
Wow, 642 pounds. Lupe's got a long ways to go, unfortunately.
You need to eat a high-protein diet. And we're going to put you on 1,000 calorie a day diet. And you're going to eliminate the carbohydrate.
So she's going from a 20 to 30,000 calorie a day diet to 1,000 calories, which is approximately half of what most women eat in a day. Let's see how she does. By dropping it to that extent, you would have to expect that she's going to lose a significant amount of weight. Have you tried my exclusive skincare line, Youn Beauty? Our products combine natural and organic ingredients with the latest and scientifically proven anti-aging components like vitamin C, retinol, and peptides. If you're looking for healthy and youthful skin without the unnecessary chemicals, fragrances, and additives, then this is the skincare line for you. I'm so convinced that you will absolutely love my skincare products that I've instituted a 30-day money-back guarantee. Check them out at younbeauty.com and enter the coupon code 20OFF to get $20 off your first order over $99. I'll put a link in the caption below.
Let's check your weight and see where you're at. You're 573 pounds. That's good.
So oftentimes, Dr. Now will test his patient to see if they can lose a relatively smaller amount of weight to make sure that they're on the right track before he considers doing any other type of invasive procedure. In this situation, she's basically stuck in the hospital because her weight is so high. They put her on that restricted diet, and it looks like she's lost a good amount of weight. So the next step is to send her home and see if she can continue that process so that hopefully, eventually, if she gets her weight to a reasonable level, she could consider having a gastric bypass or a gastric sleeve to take even that next step to better health.
We have worked to give her the tools to start to do this. So we are sending her home to try and make progress on her own.
So can she do it on her own? I think a lot of this comes down to her husband. Is her husband going to enable her, or is he going to help her to be healthier and help her save her life?
I know for the majority of the time, I need to get my eating under control. There are exceptions in life. There are days you just have to enjoy life and celebrate. So I'm just gonna enjoy it today.
Now, I totally agree with that. You know, it's hard enough in the situation that she's in to go down to 1,000 calories a day. You know, I've gone on kind of pseudo-fasting diets for periods of time where I've eaten anywhere from 600 to 1,000 calories a day, and it is not a lot of food. Now, if it's her birthday and she wants to have a slice of cake, by all means, you know, you gotta live life too. But hopefully it's not more than just a slice of cake.
It seems that her health has declined since the last time she was in the hospital. And her heart is in bad condition again.
True.
That's really sad to hear. It seems like whenever she goes home, she has people enabling her around her, enabling her bad habits, causing her not to be healthy again. And so it really comes down to, are they then going to bring her back into the hospital to control that environment again? It's unfortunate, but that may be her only option in order to basically save her life.
But this is ridiculous that you gain more weight than you lost in just a month. I'm keeping you in the hospital to start controlled diet again.
Okay, the worst thing ever would be getting scolded by Dr. Now. I mean, you gotta hand it to him. His bedside manner may not be the best, but he is always about helping his patients, and sometimes I guess you need to show tough love like that. I couldn't talk to my patients like that. It's just not me, but he does it well, so good for Dr. Now, and hopefully this ends up kind of changing things around for her. Let's see how she does.
Lupe has been in the hospital for past 2 months. We're gonna get you up today and see how your weight doing. That's 128 pounds you lost now. That's great.
Wow, that is incredible. 128 pounds after just a couple of months. Obviously, she was a couple of months of very intense treatment and watching her and limiting her diet. But she can do it. She needs to have that support system around her that will help her do that, and hopefully she can get to that next stage of the actual surgery.
For the next 2 months, I want you to lose another 75 pounds. Take this seriously if you want to get approved for weight loss surgery, okay?
Okay.
Now that's a lot of weight to lose on your own. Now, he doesn't say here whether he's gonna put her on a 1,000 calorie a day diet, maybe a little bit more than that. Other things that can be done to help with the weight loss is gonna be her trying to get more activity, getting moving. Now the truth is that what you eat impacts much more your weight than your activity level. It's really important that the number one thing is that she doesn't overeat. Adding that activity can definitely help with it, especially with her bones and all of that. It can help with the weight loss, but the most important thing is what she eats and how much she eats.
We finished running all the tests, and they're showing that your heart is too weak for gastric bypass.
Whenever you have surgery and you go under anesthesia, there is a strain on the heart. For me, whenever I see patients for cosmetic surgery, anybody who's over 40, we get full testing on them to make sure that they can tolerate the stress of the operation. And people who are older, sometimes they'll have a cardiologist that will have them do a stress test where they essentially will stress their heart. It used to be that you could walk on a treadmill and stuff and they would stress your heart that way. Now they mostly do it through chemicals actually that will be put through an IV, and they strain your heart to make sure that that strain is something that your heart can tolerate. The worst case scenario is that you don't do something like that. You bring somebody to surgery, they are put under anesthesia, there is a stress on their heart from that anesthesia and that surgery. The heart can't tolerate that, and they have a heart attack and, God forbid, even die from it. So in this situation, I applaud Dr. Now for doing this testing prior to an operation and finding out that the more aggressive, more invasive operation may not be safe to undergo.
However, gastric sleeve is still an option. It would be a much shorter operation that would not strain your body as much.
A gastric sleeve is an operation where you literally cut out a good portion of the stomach. The portion of the stomach that you cut out leaves your stomach about the size of a banana. Now, unlike a gastric bypass, it doesn't reroute anything, it just removes that stomach portion to make it smaller. That allows her to eat less food, yet still feel full quicker. Now the fact is that you can eat through this operation. Your stomach is the size of a banana afterwards, but if you overeat, you can stretch that banana back out to be a large stomach once again. So hopefully this is not something that she would do.
On a patient this size, gastric bypass is the most effective method of weight loss surgery. But in some cases, doing surgery is very dangerous as far as the heart is concerned.
The reason why a gastric bypass is more invasive than a gastric sleeve is that not only are you removing a good portion of the stomach, but you are rerouting the small intestine as well so that you can absorb less of the nutrients of the food. And in a gastric bypass, instead of leaving the stomach the size of a banana, you leave the stomach the size of a golf ball. So you can only eat a much smaller amount of food with gastric bypass. The benefit of that is that people will lose weight faster with the bypass than with a gastric sleeve, but once again, it's a more invasive operation, and in this situation, probably too invasive for a reasonable risk to undergo.
I'm encouraged by Lupe's recent progress, and this surgery will help her make even more. She stuck to her reduced diet, and she's still losing weight.
360. I think the best part of that is how excited her husband is that she is getting healthier, and hopefully he's going to be a positive part of her recovery and getting to better health than what he played, I guess, before. Well, over the past several years, I've reacted to a lot of episodes of My 600-Pound Life, and some of these stories will absolutely move you. There are people who have huge lymphedema masses hanging from their legs and their buttocks and their hips that they lose weight, they get rid of, and it's just, honestly, it's so inspiring. You gotta take a look at the compilation video that I put together right up here of My 600-Pound Life reaction videos. If you enjoyed this reaction, you're gonna love these. And remember, eat real food, use clean skincare, and auto-juvenate before you operate.